Hello and welcome back. This is Candace from Candoodle, and I'm super excited to be part of a very important hop today about mental health awareness, which I'll talk about later in this video. But we are going to be making this pretty and elegant card, so let's get started. So today I'm going to be using the Pinkfresh Studio Mirrored Triangle Stencil, as well as the fancy oval frame die, the Mama Elephant Scales cover die, and the Simon Says Stamp You Are Loved die, as well as some Altenew inks in green. And so to start off, I'm taking a card panel and I'm just going to put some little adhesive on that to stick it down to my desk. And then I'm going to use my stencil and line it up. It actually has some really awesome lines in the corner to help you line it up with your card base. So I love that. And I'm just going to tape that down with some washi tape and then come in with my lightest Altenew shade, which is Minty Mint. And I am going to just use a very light hand to stencil that with my Tailored Expressions blending brush. When I'm done with this, I am going to make sure my stencil is nice and clean with a baby wipe and a dry cloth, because then I'm going to flip it over, line it up again, and tape it down and use my second color of ink. So I love the look that this kind of gives. And for the second one, I'm going to come in with Sweet Leaf, which is a little bit darker. And so while I'm doing that, I'm going to tell you a bit about the hop. So this was organized by my friends Tasha and Colleen for mental health awareness, because May is Mental Health Awareness Month. So it depends on the region, but about 1 in 5 people are affected by mental health conditions, and less than half get the support that they need in the US every year. And there are so many barriers in the way of really getting the support that folks need. These can be things like stigma, structural barriers, and it can be quite financially costly as well. So we wanted to do this hop to show folks that they're not alone. And if you've been around for a while, you know that this is something I'm very passionate about. I did my undergraduate in mental health studies and went on to do a master's of public health. And I'm continuing my education to hopefully be a practitioner one of these days. And I did the Eating Disorders Awareness Hop, which I organized back in February, as you know, and I'll talk a bit about my own mental health journey later in this video. And so off screen, I have cut 3 of the oval frames as well as 3 of the Your Love dies from just plain 110-pound white paper. And then I did cut one of the You Are Loves from glitter paper as well. And I'm just going to stack those all together. But first, I wanted to kind of see how this was going to look on my card. So I knew I wanted the oval to go in the center, but I didn't want that background to take away from the die cut words. So I took one of the ovals that was cut out by the die on the inside and I ran it through my die cut with that cover plate just to give a little bit of texture to the background, and then I'm going to end up gluing that down on the inside. And so I usually wouldn't leave all of the gluing footage in, but I wanted to give myself some space to talk about this topic, which I think is really, really important. So trigger warning, because I will be talking about my own personal experience. So I've struggled with anxiety and OCD from a really young age. Like I remember being in kindergarten and asking to call home because my heart felt funny. And older me now knows that this was little me having an anxiety attack. But at the time, we didn't know. And when our concerns were presented to the doctors, she said that this was something I might grow out of. It's probably just anxiety. And it was kind of brushed off. And things kind of got progressively worse as I got older. And for myself, my anxiety manifests very somatically, like in my body. And so I have stomach aches all the time and nausea and things like that. And so this came to the point where it was happening all the time. I felt sick all the time that I became afraid to eat. And it led to me developing anorexia, which I talked about in my eating disorders awareness hop. And so that was really what kickstarted me getting the proper treatment, because things got so bad that I was in a hospital-based treatment program, which is where I finally got the care that I really needed. And that's where the proper diagnoses and all of that were kind of made. And something else that I think is really stigmatized within mental health, I think is becoming a lot more common for folks to talk about it, which I think is fantastic. But medication can sometimes be a bit stigmatized. And quite often we hear folks taking anticoagulants or blood pressure medication, and it's very normalized if their body doesn't have the chemical it needs to do that, and you get a medication to fix it. But for some reason, when folks have a neurochemical imbalance that can be helped with medication, there tends to be a stigma. And I'm not saying medication is right for everybody. And of course, if you want to try other things first, absolutely. But for myself and my family, there was a lot of stigma around that. And we had tried all of the talk therapies, the CBT, the everything else. And it was really the medication that changed my life and really helped me. And so that's something that it took a while to come to terms with, and I had a lot of self stigma about as well. But it's something that really has changed my life for the better. And so that's something I would encourage you to really not judge folks on, because we really have no idea what their lives are like behind closed doors. Everybody is struggling with a battle that you know nothing about. So, in a world where you can be anything, be kind. And that's kind of the way that I try and think about it as well. So, things across the years have gotten better. I'm so lucky to have the support of my friends and family and to have been able to access the treatment that I needed. And this is something that, I'm going to have for the rest of my life. And these are things that I'm going to have to be able to manage. And instead of thinking of that as a negative, I really don't think I would be the person that I am today had I not gone through this. And so I really to look at it from a strengths based approach. And so if you're out there struggling, please know that things get better and that there is hope and that there is treatment. You are stronger than you give yourself credit for, and the world is better with you in it. Thank you so much for being here and watching today's video. I really do appreciate it. I would highly encourage you to go over to Instagram and follow along the hop. I'll have everything linked down below. There are so many amazing prizes, and Tasha and Colleen have done a wonderful job organizing this. As always, you can find me over on Instagram at Candoodle Creations, and I will see you in my next video. Bye!